Looks like people are trickling in here. We're about to get started. Actually, we will get started in over a few minutes after. So I appreciate everyone patiently waiting in the waiting room, and welcome you to our second, I guess, well, technically third webinar in our educational series. This one's specifically focused on BHRT, which is short for Bioidentical Hormone Replacement Therapy. So I'm Stanley, I'm the president of MearCare, and I have Dr. Kovak, who's our chief medical officer, on as well. And today we are going to talk through very quickly what is MearCare, for those of you that are learning about MearCare for the first time. And then we're going to have Dr. Kovak speak about BHRT. That's what you're here for. You want to hear details about bioidentical hormone replacement therapy and what hormones can mean and what they can do for you. So we'll talk about that. And then we'll have a Q&A session at the end. Now, one housekeeping item on your screen, if you're on a laptop or a computer, or on your phone at the bottom, there's a little button, a reactions button. And if you click that reaction button, there's an ability for you to raise your hand. If you click that and raise your hand, Michael, who's our chief technology officer, will send you a chat on the side, reach out to you, and you can ask questions. And you can ask them anytime during the webinar, and then we'll hold them till the end, and then we'll of course ask Dr. Kovak if he can answer them for you. So reactions button at the bottom, use that to ask questions anytime, and let's jump into it. So what is MearCare? Look, we are very simply a healthcare company that is focused on bringing your healthcare to you. And the way we do that is through physician-guided at-home treatments. So we are a revolutionary service that allows you to connect with your physician, with your clinician, at any time, anywhere, to self-administer your own treatments. And you're doing that under live direction, live guidance by your physician. For those of you who have already created MearCare accounts, you've seen some of our platform, but we have a technology platform that's HIPAA compliant that allows you to connect and choose your physician, or choose a physician that you want to work with, that you would like to treat you, and also allows you to choose the treatments that you want. And we have a handful of treatments, and we're bringing on even more sort of every single day. One of the things about MearCare is that we are a personalized and a private company, right? So we're private in the sense that you can now do your treatments at home or at work, or wherever you feel comfortable, wherever you feel private, but also our treatments are personalized. They are tailored for you. There's no sort of one cut, okay, hey, you fit into this bucket, so we're going to do this type of a treatment. Every treatment is tailored specifically for you. And I know Dr. Clark said talk about that today as it relates to bioidentical hormone replacement therapy. And then MearCare, right, we're focused on convenience. We're focused on that ability for you to do it anytime, your treatments anytime, anywhere, and with the physician of your choosing. So it really puts that power into your hands. So you'll see at the top, right there up front, our mission is very simple. We're out here to try to improve health for all. We're out here to try to improve your health, and we're going to do that through offering you different treatments. Today, we're going to talk about bioidentical hormone replacement therapy. You've now heard it a few times, so we'll shorten it to BHRT. And I'm excited to hand this over to our chief medical officer, Dr. Stan Kovak, for a discussion about BHRT. Dr. Kovak.
Good evening and welcome to our BHRT webinar. My name is Dr. Stanley Kovak, and I am the Chief Medical Officer. We're going to talk a little bit about BHRT tonight. It's actually a topic that I have a lot of passion about. I've been doing it for almost 20 years, learned a lot about hormones as we age, how they change, why they're needed, and I'm hoping to bring that to you. And a lot of times people say, well, you know, why should I do hormones? And there's a lot of good reasons why you should do hormones as you age. And they say, well, isn't it just natural for my hormones to disappear and, you know, it's normal? Well, I never liked that term normal. I don't know what normal is. I mean, you know, I'm 5'9". I like to stay a half. I think I've lost that half over the years. And I'm not normal on a basketball team, but other than that, I'm normal. You know, what is normal is kind of what's the average. And as we age, our numbers drop. And so the average number drops. So that's considered normal. But is it really more what we like to call optimal? And I prefer to have normal levels or optimal levels that are when I was in my 20s for hormones, because hormones do a lot of things. They are chemicals that are responsible for exerting certain effects on target organs, whether it's your brain, your heart, even your skin, a variety of things, your lungs, you name it. And they are secreted, and a lot of people are familiar with that. They're secreted by endocrine glands, and they produce these hormones based on our needs or on their ability to produce it. As we age, we lack the ability to produce the hormones. Women know because they go through menopause. Men go through male menopause, which is called andropause, kind of a unique name, but essentially means male menopause. Male menopause is a much slower process. Female menopause, and women that have gone through it know it's all of a sudden, it just happens overnight. They seem to drop their hormones and they start having some symptoms. But it's very important for our hormones to be maintained, because hormones do specific things. They act on a cell. Okay, there's a receptors on cells that are all over the receptor. Think of the receptor as being a big ball, and or I'm sorry, the hormone or a cell being a big ball, and there's receptors on. There's little doors, and these hormones attach onto the door, and they bring in this case, what I always love, they bring in the pizza. Okay, they bring in the reaction for the cell to do things. Okay, if the hormone doesn't attach to that receptor or to the door, well, then something doesn't happen. You don't get your pizza. Okay, so these cells carry out certain functions when the hormones are attaching to it. And if they don't attach it, the cell doesn't function as properly as it could. So yeah, you can function without the pizza, but you're probably not as happy. Especially if Chicago White Sox win or something. So it's important that our hormones are working on a daily basis. There's hormones can do a variety of things. They can turn on and off machinery. They can activate certain biological functions that we want, and those functions can do a variety of things. They can increase metabolism. They can help body growth. Obviously, there's growth hormones that make your body grow a little bit. They help heal injuries, help with your energy production, cellular repair. They do a variety of things. Okay, and so it's very important that our hormones are at a more optimal level, not low levels that are very common as we age. A variety of hormones that we know of. The very common ones are estrogen, progesterone, testosterone, but there's other ones out there. Insulin's a hormone, thyroid's a hormone. So there's a variety of hormones out there that we're not familiar with, and many of them will decline as we age. You can see on the left is an image of a female hormone changes as they age, and in the United States, a typical level age is around 52 when hormones people hit menopause and it drops. You can see the drop occurs well before that, though. It's a gradual, quick decline, kind of like a little roller coaster ride, and then it levels off. And during that time, you have many symptoms. You may not, but most people have a lot of symptoms. Men, on the other hand, on the opposite side, you'll see it's a gradual decline, slowly decreases. You decrease 1-2% every year, and that gradual decline over time has an effect on us. It's just a slower decline, but it happens when we're young. Men in their 20s will be different than men in their 30s, and you look at it. Why is it that the baseball players are phenomenal in their 20s and in their 30s are not quite as good? So hormones do change. We age very slowly in that aspect as far as testosterone goes, but it does happen. So when you are replacing hormones, you want to use bioidentical hormones. So bioidentical hormones are hormones that are exactly like what you have in your body. That's why they're called bioidentical. They're identical to what is biologically available in our body. And that's what we want, because hormones that are not biologically identical, okay, your body doesn't really know what to do with them. So yes, it's wonderful. Your body can digest certain foods, right? However, we can't digest cellulose. Right? So cellulose is a food for many plants or many animals. Like, hey, cows and sheep, they can eat that type of food and they can survive on that. Humans cannot. And that's the same way with hormones. Bioidentical hormones are exactly what we have. If we use hormones that are not bioidentical, the body doesn't really know what to do with them. Yes, they can kind of function a little bit with it, but sometimes not. And many times not. And they actually can overstimulate or understimulate, or they don't break down properly and they just linger around. They cause more and more problems. So you want to have the bioidentical hormones because that's the way we're made. We're able to use that hormone and then get rid of that hormone properly so we don't have an overabundance of it, or we're able to use it properly so we don't have an under amount of it. So our goal is to not just normalize your hormone levels, but actually to optimize them. You want to get the levels that are good for you. Okay, we would love if BHRT could reverse aging. Trust me, I would. But what it does do is it actually helps with the process of aging, makes you revel in life. You enjoy life a little bit better because you're functioning more like you were when you're a little bit younger. And that's what bioidentical hormones can do. So they help essentially kind of slow down the aging process and maintain your health and good health. There's many studies that have shown that. Okay, they can decrease certain illnesses without a doubt, and they ultimately promote a better quality of life. So we say that hormones, when you optimize them, you will improve your quality of life. We can't say you improve your quantity of life, but definitely quality of life. And that's what life is all about, improving quality of life. Okay, so there's a variety of bioidentical hormones that we are using. And one of them is DHEA, which many people haven't heard of. DHEA is actually a precursor hormone. We use it to help make other hormones like estrogen, testosterone, but it does other things too. It helps with decreasing fat. It helps with your immune system. It's important that we use that. There's even studies that have shown that higher levels of DHEA decrease risk of cancer. So it's important that we have those levels. As we age, they drop. And it's just natural. It's a gradual drop, but it does drop. Estrogen, females, women, men too. Okay. Yes, men, we have estrogen in us. Okay. And estrogen is needed. It actually is a receptor that's in so many, or a hormone that's used as a receptor in so many different cells in our body everywhere. There are many estrogen receptors in the prostate gland. Okay, in the brain, you name it. And so not only do women have it, men have it. Women's have a higher level naturally, and it drops significantly more than it does for men, but it still drops in both of us. But hormones are important for your skin and your muscle tone. It's wonderful for your arteries. Estrogen is what makes a big difference between women when they're young and they don't have heart disease. While men, we don't have as much estrogen around. We have a little bit more heart disease. But when women hit menopause, heart disease skyrockets. It's actually as high as men's. And so it's very, very important that we have estrogen around, even beyond those menopause days. And naturally, estrogen is the hormone that helps you with your sexual appeal. It's the femininity hormone. Okay, it makes you feel more strong, like a woman, more sexually attracted to you. You notice it yourself. So it's very, very important to have that hormone around for a lot of reasons besides that. Melatonin is another great hormone. It does regulate our sleep, but it has other factors that it can do. It can decrease your risk of breast cancer and help with aging in the brain. It's very, very important. It even increases your platelets. You have low platelet count, so it has effect on even on your cells in your body, or your blood cells. So melatonin I take on a daily basis, every night, I should say, nightly basis. It's very important. Progesterone. Well, when we were created, okay, and whether you believe it, that God did it or whoever did it, but we were created to have progesterone in us and estrogen. Okay, progesterone is the yin to the yang of estrogen. It's the opposite. Okay, so it does a variety of things. It helps control estrogen, so we don't have a over exuberant response to estrogen. But it also works in other ways. Decreased risk for colon cancer, decreased risk for breast cancer, helps with bone growth, makes your bones stronger. A variety of things that it does. Again, it's very important for female optimal health. Testosterone, we know it's a sex hormone for males, but also for women. It does a variety of other things too. They've shown in studies that testosterone causes breast cancer cells to die. And it's called apoptosis. They kill breast cancer cells, but it also makes your muscles stronger, decreases your central fat, makes your heart better for men. Besides, it has the increases your sexual appeal and your strength. So it's a very important hormone for both men and women. Another hormone that we don't really think much about as a hormone, but it's thyroid. And your thyroid hormone helps regulate your temperature, metabolism, does a variety of things, helps keep you thinking straight. When that drops, we struggle with brain fogginess or a variety of things, and whether it could even affect your hair. So thyroid is another hormone that we like to check, and it always seems to decrease as we age. We're waiting for the next slide. I'm sure we have. There we go. There's the next slide. So definitely, it makes a big difference in that. We know that sexual awareness is important for us all the time. September happens to be Sexual Awareness Month, but we believe that, naturally, everyone believes that it's important all year long. Okay, but sexual health, what does it cover? It's a variety of things, right? It's anything from safe sex to consent among others to healthy relationships. Sexual pleasure is what people think of all the time, but really it's a variety of things. But sexual health is definitely key overall to your overall health, I should say. And it's because think of what it involves. And if you have good sexual health and all these different broad topics of sexual health, your overall health seems to be better. And hormones play a critical role in that sexual health and sexual drive in particular, your libido, both estrogen and testosterone. Men need testosterone in order to have a good sexual function. Women also need that to have sexual desire, and also helps with sexual function. By increasing those hormones or keeping those optimized, okay, you increase your interest, your desire. Okay, you also reduce your problems associated with any kind of dysfunction. So it's very, very important that we keep those levels up at optimal levels. Now, the BHRT experience is different and unique in that there's always a consultation first, and the physician will determine whether or not you need BHRT and if it's appropriate for you. If that's determined, then a blood test is gathered. And blood tests can consist of hormone levels, plus usually it's many times a variety of things, everything from your blood count to your liver functions to your cholesterol levels. Once that blood test is received, then there's a follow-up telehealth consultation with you, in which the physician will go over your blood tests and determine what is the best approach, what recommended hormone replacement that you need. Once that happens, that's when you will receive your medications, and then you have the option for patients that are going to get injectable treatments. They have the option to have another physician-guided treatment so they can see what in order to do it properly. What's very unique about it, we talked about this, is that you can set up your appointments on your own, and you have access to the very best of physicians that are very familiar with hormone replacement. We are doing what we do now. We have these educational seminars and ongoing training. And what's also great is that you are having your own active involvement, okay, in your own care. And that just makes you more desire to learn more and understand a little bit more about healthcare. Okay, you have options, obviously, for live guidance, but most importantly, that each and every single one of you have your own personalized medical treatment. It's tailored towards you. Everyone is different, and so what requires one person may not be required another person, or may be slightly different as far as dosages. And when we do our approach, it's dosage-based, personalized medicine that's for you, tailored towards you.
Okay, Dr. Kovak, thank you so much for walking us through that. Quite a lot of information, certainly for people to digest, but now we've reached the Q&A section, where I would remind everyone again, if you haven't raised your hand yet or been raising it throughout the session, please do so now. You can select the reactions button at the bottom of your screen, raise your hand, and Mike will reach out to you. Michael's audio is not working, so I will be taking up the questions, but he's sending them to me right now. So we've gathered a few of them. And before we jump into those, I just want to remind everyone that we are continuing these educational sessions, these seminars. We're looking forward to introducing some on neurotox and certainly some other treatments that we're getting prepared to launch as well. All of our contact information is right here on the screen. You can certainly follow us on any of the socials, and you can go right to mirror.care, .care, not .com, to actually learn even more about Mirror Care. One other thing I wanted to touch on really quickly, one of the ways that we are unique is right now those consultations, that initial discussion with a physician is free. There's no charge for that currently. We want people to have the opportunity to discuss this with their physician, a physician of their choosing, and determine if it's even something that might be appropriate for them. So with that, Dr. Kovak, the first question that we got today was actually about hormones versus vitamins and supplements. Why would you want to use hormones versus vitamins or supplements?
I like using both. Vitamin supplements are, I think, also important. There's sometimes we don't have adequate diet, and so we don't get enough vitamins. But vitamins and hormones and supplements and hormones are two different objects. Vitamin supplements you can get in your food. So if you eat a proper diet, you may not necessarily need vitamins as much, but you can't get hormones in your diet. You can use yams, and there are certain black cohosh that help with symptoms that women are experiencing during menopause, but they hide the symptoms. They don't do the effect on cells with the metabolism and making the cells work properly that hormones do. So hormones have to be given as a decrease as a drug, while vitamins and supplements you can just take as pills at the over the counter or in your food.
Great. Excellent. Well, we had another question come in asking specifically about BHRT and how quickly can this individual potentially see results?
That's a good question. Results. So it all depends on what you're attempting to achieve. So if it is a woman that is experiencing night sweats, you can fairly quickly see those night sweats disappear or the brain fogginess disappear. If it's a man who wants to see increased strength, that's going to take a little bit of while, okay, because muscles develop over time a little bit of strength. So it all depends on what you're trying to achieve. But gradually, the most important thing is that you're reversing those aging symptoms. And it takes a little bit of time to see some symptoms, and sometimes can go more quickly.
Great, thank you. Well, we had another question here from an individual who's asking about pellet therapy, and would you do pellet therapy, or is that something that's on MearCare?
So that's actually a great question, because pellet therapy, you can use bioidentical hormones with pellet therapy. I'm just not a big fan of pellet therapy. And the reason why is, one, pellet therapy is a surgical procedure. They're actually inserting the hormone subcutaneously. There's a small incision, and you kind of stuff it in, kind of like you're stuffing a pillow into a little subcutaneous, a little fatty tissue. And the pellet is in there. It has a chemical in it, and it slowly dissolves away, and it gives you the level. Gives you a level of a particular hormone. It's nice because it's convenient. You do it once, maybe every 3 months. But it's not good because that's just not how our body works. Okay, our body has circadian rhythms, and that means that we kind of go up and down. I don't know if you can see my finger, but we go up and down throughout the day with cycles of hormones. And so typically in the morning we go up, then we start to drop. There's sometimes little spikes, but we go down in the evening, we go back up at night. And many of the hormones, they do that. And that's a proper way for your body to adjust and deal with hormones. When you have a constant high level, okay, your body is being bombarded all the time with these hormones, and it makes a new level because it says, okay, well, this is the level I'm supposed to be now, not down here. I'm always up here. So in order to have a response, you have to have even a higher level to kind of get that response, as versus when you drop down, your body's used to that lower level. When you go up, it responds then to the higher level. A good analogy of that, and it's a real simple one, is when you're in the car, and you're by yourself and a good song comes on, who doesn't turn it on a little bit loud? You know, if you're stuck at a stop sign and it's a little bit loud and it's banging in your ears, you're not going to keep that music on continuously that loud. That's kind of what hormones do with pellet therapy. Constantly high level. It's too much for your body to handle.
Great. Well, we are getting close to the top of the hour here, and we wanted to make sure that we give everyone their time, right? Convenience and being respectful of your time. I've got one more question, Dr. Kovak, that I'll share. And then for those of you who don't get to, we'll reach out to you after the session, of course, and we'll get your questions answered. The other question here from an individual, they're asking, why do you require blood tests, and why not like saliva tests or other tests? Well, why blood tests?
So that's another good question, because there are some places that do saliva tests or they do urine tests. And I think those are great if you want to know what your level is in your saliva and your urine. I want to know what your level is in your brain. Okay. Saliva, urine doesn't go to your brain. And I want to know what your level is in your heart. Saliva and urine doesn't go to your heart. All right. Those levels are trying to guesstimate, when you do those tests, trying to guesstimate what the levels are in your heart. They're easy to do. I'm sorry, in your blood. They're easy to do, but they don't really tell you what's in your blood. I want blood levels. Then I know that those hormones are, that those numbers are what's going to your heart, your liver, your lungs, your brain, every organ in your body. So that's why I prefer blood.
And all the organs that your hormones travel to. So
all the organs.
Well, I really appreciate your time, Dr. Kovak, and more importantly, really appreciate everyone for joining us for this session. Again, we're going to be having more of these, so if you haven't signed up for emails yet, please do. Again, you can send us more questions anytime you'd like, or reach out to us by phone, and really appreciate it. Everyone have a very great evening. We'll talk to you soon.
Thank you. Good night.